Hi, everybody. Thanks for tuning in to my public health influencer and leadership presentation examining Dr. Scott Gottlieb. I hope you all find it enjoyable and insightful. Dr. Scott Gottlieb is a renowned physician, a popular news and media contributor, and a prominent public health leader. Dr. Gottlieb is the former commissioner of the U.S. Food and Drug Administration from 2017 to 2019. Dr. Gottlieb currently sits as a board member for the drug company Pfizer, is a senior fellow for the public policy think tank the American Enterprise Institute, and is a partner or board member for several other medical and venture capitalist groups. During his tenure as the commissioner of the FDA, Dr. Gottlieb was regarded as an exceptional leader of several public health initiatives and programs and was considered by his peers to be a man serious about the science. He would regularly leverage his clinical expertise and passion for quality research to approach public health issues from a nonpartisan position. In doing so, he has also positioned himself as a reliable source of health information for legacy media outlets and somewhat of a social media icon for health topics, demonstrating his substantial influence over the public and private sectors. This presentation intends to examine Dr. Gottlieb's leadership skills and styles over the course of his career and take into consideration the influence he has over public opinion to assess the ethical implications of his public health leadership. In his position as the commissioner of the FDA, Dr. Gottlieb is credited with spearheading the fight for critical public health topics, including the opioid crisis, high drug prices, and teen and youth vaping. In his role, he introduced stricter opioid prescribing guidelines, expanded access to life-saving treatments like naloxone, and encouraged the development of non-addictive pain management therapies. He worked to restrict the sales and marketing of many flavored tobacco products and even floated the idea of banning all e-cigarette products from being sold to curb accessibility to minors. Dr. Gottlieb is renowned for his efforts in streamlining the process of reviewing and approving new medications, often for significantly lower prices for public distribution. His leadership actions and initiatives have modernized traditional FDA processes to expedite approvals for critical medications and support groundbreaking treatments such as cell and gene therapies. Dr. Gottlieb exemplifies several key leadership principles in his public health work. First, he knows how to envision what he considers the most effective or helpful policies. This can be demonstrated by his efforts to emphasize the importance of a robust pandemic preparedness plan and infrastructure to include more complex, dynamic research clinics, improved surveillance systems, and rapid response teams to mitigate another potential crisis. Second, Dr. Gottlieb is a champion of collaboration for accomplishing the most pressing public health challenges. He has worked closely with other government agencies, healthcare organizations, and major pharmaceutical companies to expand public access to medications and accelerate manufacture and approvals of new drug treatments. Lastly, Dr. Gottlieb embodies guided decision-making to help community leaders promote the best health outcomes. During the COVID-19 pandemic, he advocated a data-driven, phased plan to reopen the country that considered both public health and economic impact. These principles not only demonstrate his strategic leadership, but also highlight his ability to build consensus and inspire action in challenging situations. Dr. Gottlieb's influence on public opinion has been profound throughout his career. He has over 500,000 followers on X and uses this platform to communicate health information, share research, and discuss current events related to public health. He is also regularly invited as a guest contributor for CBS's Face the Nation, making him a leading voice for medicine and public health to millions of viewers. Dr. Gottlieb's communication was especially present during the coronavirus pandemic. His clear, science-based communication helped enhance public understanding of complex issues like variants, encouraging proactive health measures like vaccination and social distancing, and working to quell fear and promote trust in science and public health professionals. These leadership efforts were not without challenge, however, as his communication was often met with criticism. His nomination and confirmation as the FDA commissioner were the subject of great discussion due to Dr. Gottlieb's history with the pharmaceutical industry, which created a potential conflict of interest in his promotion of new medications. He also received a lot of backlash for his encouragement of lockdown protocols due to infringement on personal freedoms throughout the pandemic. Despite this, however, Dr. Gottlieb is regarded as an exceptional influence in public health, due largely for his activities in the FDA and his media presence, making him a very trusted voice for the nation. To analyze Dr. Gottlieb's ethical leadership skills, we can consider Peter Nordhaus's 5 principles of ethical leadership. Dr. Gottlieb's leadership and influence are correlated with the ethical principles of manifesting honesty and serving others. These 2 principles also resonate with the concept of duty ethics, highlighting a tendency to adhere to rules and protocols to uphold truth and responsibility. These ethical leanings are demonstrated by Dr. Gottlieb's commitment to ensuring that evidence-based information is communicated to the public for the sake of education and combating misinformation. His transparency about the limitations and uncertainties of public health strategies, as well as disclosing his previous affiliations with pharmaceutical companies, created some difficulty, but ultimately helped establish trust with the public. These actions articulate Dr. Gottlieb's passion and responsibility to being a public health servant for ethically providing the best information for the public. Throughout his career, Dr. Gottlieb has proven himself an effective leader and influential figure in public health. His dense resume of accomplishments, proposals, campaigns, and initiatives have bolstered his credibility and allowed him to channel his expertise to the public and private sectors. Considering his leadership skills, Dr. Gottlieb is a champion of data-driven information, health education, and health promotion to be a good steward of public health. This has made him such a recognizable and dependable voice in public health, which merits his substantial following and regular appearances on national television. Dr. Gottlieb is a prime example of an individual who demonstrates ethical leadership skills in his nonpartisan work in public health, bridging the gap between social and political divides and letting the science speak for itself to prioritize health. Thank you so much for taking the time to watch my presentation on the leadership of Dr. Scott Gottlieb. I hope you found it enjoyable and engaging. Here are some of my references. I look forward to hearing your feedback in the discussion. Thanks.